Welcome to the first afternoon session, and I'd be delighted to introduce you to Tim Perkins, who's co-founder and CEO of Nudge. It's going to be a really fascinating 25-minute slot. Same reminder as usual, please use Slido for questions. I don't think you've got any polls, anything like that, no. So questions on Slido, and we'll make sure we've got a bit of time at the end to go through some of those. So over to you, Tim. Thank you.
Brilliant. Thank you very much. A bit confused there hearing afternoon. I thought I'd missed lunch, but in case anyone else was wondering the same, no, I think lunch follows this. So 16 weeks ago, exactly to the day today, 16 weeks ago, I moved house. And the reason I know it was 16 weeks ago is because I've just finished my 4-month prescription to a very, very clever drug called Ramipril. And I'm not sure if anybody knows what Ramipril is, but Ramipril is if you have high blood pressure. And so I had quite a complicated house move. Otherwise, pretty healthy person. I have to have regular health assessments through work, normal blood pressure, but moving house was pretty bad. Cut a very long story short, a week before we were due to complete, when we exchanged, we found out that actually there weren't the 3 people in the chain that we'd been led to believe. There were actually 6. Friday the 28th, which is when it was, there was also a banking outage. So we had this situation where we'd sold our house, but we couldn't buy the house that we were moving into. So I had 3 kids and a dog and a wife, not knowing what we were going to do. And it was complicated. Complicated for mortgage, complicated for insurance, had all sorts of extra costs for removal people. So if anyone else has moved house recently, you'll know it's really, really stressful. And, really easily demonstrates, I guess, that connection between money and physical health. It's the first prescription that I've taken in donkey's years, but I'm off it now. My blood pressure's back to normal. So that's the good news there. So, with that in mind, when I saw the title for this whole event, so for REBA's event, which I'm conscious you've probably spoken to lots of people already today, so I'll read it back just to remind you. When I heard this, I was like, this is such a relevant session, such a relevant event. So the title of this whole event here today is, or the way that REBA described it is, as societal health declines and medical and protection benefit costs soar, businesses face a perfect storm threatening productivity, performance and profitability. Add rising employee financial pressures and the message is clear: proactive support is vital. The focus is now on strategic prevention, leveraging benefits to tackle people risk head on, protect the workforce and drive sustainable business success. So, bearing in mind what we do, which I'll come on to in a minute, and, my own personal story, this just, really stood out for me. But I did have mixed feelings. I was firstly, I guess, a bit depressed by this, reading in black and white just how much sicker we're getting as a nation and as a world, and a lot of it, potentially avoidable. But the other side to my thought was a real feeling of optimism that, this is not something that we necessarily just need to accept. And, what I love about this industry, having worked in employee benefits for almost 25 years now, is just, the opportunity that we have as benefit professionals to solve these massive, massive problems. And as I say, I've been in the industry for a long time. And if I think back to, the evolution of employee benefits over the last few years, I think there has been a bit of a danger that some benefits have become a bit trivial. Perks, you might want to refer to them. But actually, if you kind of keep digging, the original purpose of employee benefits was with employers in mind, health insurance, about getting people back to work. And so I think that maybe we're a bit of a tipping point here where people are rediscovering employee benefits as the strategic tool that we all know that they can be. And this also kind of really resonated with me when a couple of weeks ago I was at an event in Belgium, which I've seen a few other people here today who are also there. And I was listening to the senior medical director of UHG, so United Health Group. They're a $360 billion healthcare organization. And she was talking about reconfirming, I guess, that we're all getting sicker. She was talking about health insurance premiums increasing 15% year on year. And 15% compound effect of that over 5 years, that means your premiums double in 5 years. And this is not sustainable. And so we need to do something about it. We need to fix it. And there's real optimism that the rest of our employee benefits give us a tool to do that. And today, I'm going to show you one way. So in terms of us as an organisation, I know we've got lots of clients and people we're speaking to in the audience. Hello, Naomi. So great to see some familiar faces. But for those who don't know us, so we're a workplace financial education specialist. So we work with the employees of about 4,000 employers across 160 countries. And we help those people better understand and better manage their money. And the way that we do that is through the world's most connected financial education. So connecting HR, payroll, if employees want to, bank accounts, research, government data, all of this information connected to provide people with personalised, in the moment, impartial financial education. And as a result of that, people are more confident, they're saving more, they're spending smarter, they're better using their employee benefits. And very topical, so today, 25 minutes ago, the Bank of England made their interest rates announcement. It's those types of triggers that can behind the education that we're delivering. So if we think about then one of those sources of information that we're getting that's driving the personalised education, one of those sources of data is research. And so we lean on this organisation called Census-Wide a lot. So Census-Wide deliver a lot of research in this space. And bearing in mind how sensitive and how potentially dangerous money can be, it's really important for us that when we're aggregating this data to drive the education, it comes from a credible resource. So Census-Wide tick all the boxes. They're a member of the British Polling Council, fully subscribe to the SMR principles, the MRC Code of Conduct. So a very, very credible source in that regard. And so there's a huge amount that they reveal. But one of the key findings relevant for today was that connection between physical, mental, social, and financial health. So as you can see, those people who report having good and excellent financial health are 7 times more likely to rate their mental health as excellent, 7 times more likely to rate their social health, 6 times more their physical health. And so, perhaps there's a discussion here around cause and effect, but the bottom line is where people have improved financial health, they are healthier. They are more balanced in their lives. And so with that in mind, how can we actually think about improving people's financial health? That's going to be brilliant in its own right, but it's going to have such a measurable and demonstrable impact beyond as well. So one of the questions that Census-Wide asked was what conditions had people experienced as a result of money? And some massive percentages here, which hopefully the numbers aren't too small on that screen. They certainly are on this screen for me. So some big numbers, and I'm sure not surprising to a lot of you. And I think this matches that recognition from REBA about the increasing sickness and financial pressures that people are feeling upon themselves. And of course, what's the impact of this? That there are indirect costs. So if people are stressed or not sleeping properly or social withdrawal or whatever it might be, there's those indirect costs that people are distracted. This is on their mind. They're worrying about it. They're absent. They're much more likely to not be at work, and they're tired. So they're definitely not giving their best. But there's also a very, very direct cost of these as well. So, and specifically, I guess, healthcare. And so, as per the title of this whole session that I was running, we know there's a cost here, but what if there's a way for us to manage this cost? And that's really where financial education comes in. So what we've got here is that same chart, but we're overlaying now those people who have financial education versus those people who don't have financial education. And it's very, very striking. You can see that without exception, across all of these conditions, the pattern is clear. Where people are on top of their money, they've got that financial education, they are less likely to be reporting these physical health conditions. So some of the anxiety, for example, 31% as a result of money. If you then look at those people who don't have financial education, think from memory, although I'd say it's a bit small on here, 37%. And then you can see the positive gain that where people do have financial education. Or sleep, 32% of people who don't have financial education are saying that their money has caused a negative impact, compared with 25% of people where they do have that financial education. Depression, there's obviously a massive difference there. 34% of people who don't have financial education, compared with the 16% who do. And if we look right to the right-hand side, suicide. It's such a, so this is, I guess, so powerful on a human level. Our role as employee benefits professionals is partly to protect our people. So it's, very, very strong and powerful in that regard. But imagine then if you start to overlay the cost of this. So, for example, in the UK, the cost of depression, this comes from the Centre of Mental Health, cost of depression is £300 billion a year. Now, if you break that down, there's lots of bits that kind of make that up, but the treatment cost, so the health cost, is £25 billion a year. So if you can swing the proportion of people who are feeling depressed or have depression as a result of their money, if you can swing that from 34% to 16%, that is an enormous, and I've calculated it, £14 billion swing. So if you think you can really see how you can start to proactively help people with these, get on top of these conditions and the impact that will have on their health, and ultimately in terms of that insurance as well. So one thing that with the conversation we're having with our clients now, and I'd encourage this for non-clients alike, is to really dig into your healthcare costs. For those of you, I'm sure most of you have healthcare premium policy. It might not be for everybody, but certainly for those people you do. Really dig into those. Really dig into those conditions. What's sitting behind your premiums that are escalating at 10, 15, 20%. Because if you really start to understand this stuff, then you can put specific plans in place to try and get on top of that. And I'll give you an example of a client who's seen a positive impact of that in a moment. Unsurprisingly, if people are healthier, which as we can see here, they also feel better. And so there's some powerful data from census-wide in this regard as well. So what we can see is that where people have financial education, they've got more pride, they've got more hope about their finances, they're less anxious, and there's less shame as well. And that's a really powerful word. Terrible to think that people would feel shame around their money. And so what we can see then on the right-hand side, because a bit like our solution being global, that all of this research is global as well, this is showing the countries where they have the biggest difference between those employees who have financial education versus those the people who don't have financial education. So if we kind of double click on those, so in the US, I spend a fair amount of time in the US. We've got lots of clients there. I've got lots of colleagues there. And for anybody who's in a similar situation and familiar with the US, that probably won't surprise you to see them there. There's a real confidence in the US, and when you do well, you're proud. You're proud you've done well. They don't have the safety net that we have in the UK. If you do well, you've done well in many cases through kind of hard graft. And so we know that there's a correlation between those people who have financial education and the confidence that they have. And so that confidence supports that. So I'm not surprised at all to see the US as the organisation that has the biggest gap in terms of people's pride between those who have financial education and those people who don't. The UK, it's not quite so simple for me though. I personally, I haven't quite been able to work out, why here in the UK we have that biggest gap between people's hopefulness compared for those who have financial education for those who don't. So, there'll be an opportunity for questions shortly. I'll be interested also to get anybody's view or opinion on what the reason behind that might be as well. We have a lot of clients who have a big presence in Latin America. And for any of you who've got employees in Latin America, specifically in Argentina, you'll know that it's a really tough place over the last few years. Argentina traditionally had a very strong social support, but there's been incredible instability over the last 18 months in particular, where the current president, Javier Milei, has come in and kind of ripped everything up in terms of the way that personal finances work, the support that people get. So I don't think it's surprising to see anxiety levels high in Argentina, but those people who have the financial education and therefore the facility to equip themselves to deal with that change, they're seeing a significant impact in terms of how that's supporting them. And then Shane, so Singapore. So Singapore is a global financial hub, attracts a lot of high net worth individuals. Wealth is very much celebrated there. So it's not perhaps surprising to see the biggest difference there. There's also then an interesting connection beyond work. So thinking about people's relationships. So my wife, Laura, pretty often reminds me, happy wife, happy life. And and it's true. If I'm happy at home, I'm happy at work. And so, with the exception of South Africa and Australia on this chart, you can see here that those people who have financial education are explaining that their financial behaviors have increased the trust and the transparency in their relationships. And that's such an important part of people's overall life and ultimately the way that they're going to be able to commit themselves and deliver to you as an employer. So if we look at this, then I can't remember whether I'm aiming for 5 or 0 on this clock, but I'm going to do my thing. So if we think about this through the lens of a client, so this is a client we've worked with for about 5 years now. They're describe themselves as an advertising tech firm, and for about the last 3 years, as you can see, they have been using Nudge's financial health score. So what this does is aggregates lots of data based on their employees and rolls that up into a score, which demonstrates their financial health. As you can see, that's broken down against 5 different pillars. And so, for example, borrowing is checking the sustainability of people's borrowing. So it's fine to borrow as long as that's done in a sustainable way. And so what you can see for their entire workforce over the course of those 3 years, you can see how that financial health score increased across those 5 pillars. Now, interestingly, coincidentally, they also have UHG, so United Health Group I referenced earlier. They are their healthcare provider. And over the course of this period of time, what the data they're getting back from UHG is that their resilience has increased. One of the ways that they've been able to demonstrate that is there is a much bigger proportion now of their medical claims are coming from musculoskeletal conditions rather than the physical and the mental health conditions that they were supporting previously. Off the back of that, they're actually up for an award at our Financial Wellbeing Impact Awards next week, which a few people in this room I know are going to be joining us at, a real celebration of organisations who aren't just ticking a box with this stuff, but they're demonstrating impact. We've provided this programme, we can see people's financial health is changing, and this is the demonstrable impact on our healthcare plan. So that's a really powerful example for me. What we are seeing though is as useful as this kind of aggregated data is, you kind of forget that there's humans sitting behind this. So for anybody who's embarking on the journey of introducing one of these types of programs or tracking the impact of it, I'd really encourage you to find the time to think about the personal stories as well. And so this is one employee who works for that employer. And so you can see over the course of that 3-year period, well, it's just in this case, just under 3 years, how that financial health score changed, and get a flavour for some of the things that they were, how their financial education journey evolved along the way. So yeah, that is on the basis I didn't know which time I was aiming for. That's pretty much me. But to summarise, there is very clear data, as you've seen, linking that financial education, financial well-being, and health. We know that if people are healthier, then they're happier, and that isn't just at home. That obviously extends to work, and there's all sorts of benefits that come from that. And there's a real opportunity here for businesses to benefit as well. As I say, I think employee benefits are entering a new chapter. This isn't just about perks. This isn't just about competing with organisations who you're looking to recruit people from. This is about really thinking about the strategic opportunity that these employee benefits provide you with. And the data is very clear that one of the biggest problems that many of you have is the cost of poor health, of sickness. And this is one tool of, I'm sure, a few that can help you address that. Thank you very much.
Thank you very much, Tim. So we do have a few minutes for some questions, either on Slido, and there's one on Slido, or if you just want to sort of pitch in as well. So I think if we, it's actually disappeared. There was a question. Do you know, can we get back to what the question was on Slido?
Or a raise of old-fashioned hand raise.
Was there a question at the front there? Oh, it is on the screen. Thank you very much. So yeah, do you see any trends in the types of employee who are more likely to engage with financial wellness initiatives?
I think the way that Nudge service works the way that Nudge works, which I appreciate isn't perhaps the standard for other organisations, is that people are automatically enrolled into the programme on the basis that we are not just educating people on their personal finances, but on their pensions, their equity plans, their EAP. 95% of our clients see this as a tool, as an employer tool, and thinking back to that kind of employer benefit. So with that in mind, everybody's engaging because you're getting this education and you're clicking through the links and you're using the services that way. I think what's interesting is how the specific topics that people are using and relying on something like Nudge for, how they're changing over time. I guess a really interesting example of this, if I think back to COVID, feels like thankfully a long time ago now, that journey we went through from March 2020 to March 21, it was incredible how we saw, to start with, there was clearly worry, the topics that people were learning about. There was a lot of people looking at making sure they were maximising their government support, for example. That fairly quickly then reverted into a big focus on saving. A lot of people weren't commuting anymore. It was lovely weather, so you didn't have your heating bill. So it was clear that there was a lot of money being committed to that. And then unfortunately, 6 months later, we saw a lot of people learning more about relationships, cooped up together at home. So it's a kind of real interesting barometer and pulse of generally how the world is feeling. I think generally we see probably a flattening out in terms of how people are using this. So if I think back to when we first launched Nudge, it was probably more a default usage from older people, wealthier people who perhaps perhaps there was an assumption that you had to have money in order to see a program like this. But I think we're probably seeing a leveling out of that now. People are clearer that financial wellness isn't just about wealth. It's about my whole financial situation. So bit of a roundabout answer, but yeah, hopefully helpful. Describe the benefit. Yeah, describe the benefit of nudge in a mobility perspective. So it's very interesting because money touches every part of people's lives. It could sit in all sorts of different buckets within an organisation. It could be a pension piece, could be an equity piece, it could be well-being, it could be comp and bends. We're seeing an increasing number of organisations actually now having global mobility stakeholders involved in the discussion as well. So I've got one client, for example, in Ireland, 1,500 employees, they had 90 nationalities represented. So there's a lot of people landing in Ireland. They don't know how personal finance works. So, there's a very strong connection there and way that they're using a tool like this to make sure that people settle and are able to get up and running and productive very, very quickly. And I've just seen more questions that have come up that we don't think we've got time for.
It's often the way there's slightly more questions. We'll wrap up here. However, Tim, are you around for the rest of the day?
We are on the other floor. Can't remember if I came up or down. And we're kind of as if you're heading back out the exit on the right-hand side.
So please do see Tim and his colleagues out. And please, again, on Slido, you'll see there's a little prompt for some feedback. So please do take time to do that. In the meantime, thank you very much.
Thank you.
Great.
Cheerio.